Hi, I'm Dr. Sowjanya, pediatric specialist at Akkineni Hospitals, Vijayawada. Hope you and your family are doing well. Let's go through some essential points today. Stay engaged and note them down.
Welcome to this explainer. Today, we're diving right into a massive public health crisis that is, quite frankly, heavily clouded by blame, stigma, and a whole lot of deep misconceptions. We're talking about pediatric obesity. It's time to radically shift our understanding, ditch the judgment, and unmask the hidden biological drivers that are actually at play here. 14 to 19%. Just let that sink in for a second. That is the staggering percentage of urban Indian school-age children currently facing obesity. No, look, this isn't just about kids outgrowing their clothes a bit faster than usual. No way. This is a condition setting off silent, early-onset metabolic damage that can stick around for decades if we don't catch it. So here's our roadmap for today to help shift our perspective. We're going to cover the hidden pediatric crisis, look at why it's more than just baby fat, untangle the web of complex causes, talk about assessing the whole child, and finally wrap up with family-centered healing. All right, let's jump straight into section 1. The hidden pediatric crisis, defining the scale and the standard. To really get this, we've got to completely throw out how we typically think about weight and measurement. You see, children are not just small adults. For us adults, BMI relies on these rigid, fixed numbers, right? Like 25 means overweight, 30 means obese. But for children, their bodies are literally constantly changing. That's exactly why child BMI relies on age and sex-specific percentiles instead. So flagging a kid at the 85th or 95th percentile isn't an immediate disease diagnosis. Think of it more like a vital statistical risk flag. It's an alert telling us, hey, clinical attention is needed right now. Which brings us to section 2, more than baby fat, the unseen medical and emotional toll. Let's see how this goes from what people think is just a cute childhood phase straight into a systemic metabolic crisis. Here's the scary truth. Excess adiposity does not politely wait for adulthood to start causing damage. We're actually seeing conditions that used to be exclusively reserved for middle age, things like insulin resistance and type 2 diabetes, now being diagnosed in teenagers. It's wild. We're talking fatty liver disease, early plaque buildup in arteries, and severe orthopedic issues like knock knees, basically because the excess weight puts so much stress on growing bones. It even causes obstructive sleep apnea. So kids are walking around exhausted all day, and you know what? That often gets completely misdiagnosed as them just being lazy. But, the toll isn't purely physical. Independent of all those physical ailments, these kids endure an absolutely massive psychological burden every single day. We're talking measurably higher rates of peer bullying, social exclusion, plummeting self-esteem, depression, and anxiety. These are not just passing, moody adolescent feelings. They are serious, deep harms that demand our empathy. And this leads us to section 3, a web of complex causes, biology and environment, not blame. Listen, to truly solve this crisis, we have got to explicitly remove the shame. This is absolutely not a character flaw. Weight gain in kids is actually driven by this intricate, messy web of interacting factors. It is so far beyond a simple calories in, calories out equation. I mean, sure, we have the environmental issues, right? The ultra-processed foods everywhere, the high screen time, but the biological drivers, they are wild. We're talking about inadequate sleep, total imbalances in the gut microbiome that dictate exactly how energy is extracted from food, and get this, over 200 distinct genetic variants that directly influence obesity risk. 200! Let's zoom in on just one of those factors for a second. Sleep. When a child doesn't get enough sleep, it literally sets off a biological chain reaction. It totally scrambles their hormones. It spikes ghrelin, which is the hormone that stimulates appetite, and it completely tanks leptin, the hormone that actually tells the brain, hey, we're full. It's basically the biological equivalent of driving a car with a broken fuel gauge. The child becomes constantly hungry and just never feels satisfied. So you see, it's pure biology. It's not a lack of willpower. So how do medical professionals actually step in to help? That's section 4, assessing the whole child, a comprehensive clinical rescue. Because we're dealing with such a complex metabolic condition, pediatricians have got to evaluate the patient with serious comprehensive medical rigor. A proper clinical assessment treats the child as a whole, interconnected system, not just a random number on a scale. Doctors need to proactively screen for hidden issues. They're checking blood pressure to catch asymptomatic hypertension, drawing fasting glucose to look for prediabetes, and running liver and lipid profiles.
They also use all these evaluations to rule out secondary underlying causes, things like hypothyroidism or Cushing syndrome. It's a holistic, top-to-bottom medical rescue.
Now, the big question, how do we actually fix this at home? Section 5, Family-Centered Healing. Healing the environment, not punishing the child. This brings us to the final and honestly most uplifting part of our explainer, the practical path forward. The absolute bedrock of treatment here is an evidence-based intervention called family-centered management. Because frankly, targeting the child alone, it's completely ineffective. If you're raising a child today, here is exactly why you need to look past the bathroom scale and take a hard look at your household environment. True healing requires the entire family's eating patterns, activity levels, and home environment to adapt together as one unified team.
And here is what that team effort actually looks like in practice. Surprisingly, the focus is entirely on improving dietary quality without restricting a growing child's calories. Let me repeat that. No calorie counting. Restricting calories can severely impair a kid's natural growth. Instead, the goal is getting 60 minutes of daily physical activity, capping recreational screen time at a maximum of 2 hours, optimizing sleep, and, crucially, getting those ultra-processed foods completely out of the house. Now, it is absolutely crucial to note that extreme measures, things like bariatric surgery or pharmacological medications, have a very limited role. They're absolute last resorts in pediatrics. We're talking strictly reserved for severe cases in adolescents who already have serious comorbidities, and only when those lifestyle interventions have genuinely failed. So the vast majority of our focus, it has to remain on those achievable daily lifestyle changes. As we wrap up this explainer, I really want you to take this away. Childhood obesity requires medical empathy, not shame. It's a highly complex metabolic condition shaped by biology and our modern environment. So I'm going to leave you with this final thought to hopefully spark a much-needed conversation in your own homes. Are we finally ready to stop blaming the child and start healing the family?